We are now live. TikTok live number 80. Guys, we're up to the 80th episode here. So I got the live going, recording in the back. Top 5 listeners of the whole TikTok live. It shows me the stats in the back end after I finish. Top 5 listeners, you guys get a shout out. I'm going to give you guys a shout out in the caption of YouTube, all the podcast platforms as well, Spotify. In the caption, I give you guys a shout out. All right. Top 5 listeners get a shout out. TikTok live number 80. Let's begin. First question is asked by GMFFL. Is there any way to surgically lower the ramus? When you say surgically lower the ramus, so the ramus you're talking about back over here, right? This is the ascending ramus going up here. You got the condyle in the back. You got the coronoid process in the front. This area of the jaw is the ramus. Over here, you have the front jaw. This whole lower jaw is the mandible. This is the ramus. So surgically lower this? Are you trying to lower it, or did you want like a more defined gonal angle? Let me know. Let me know what you think. You're saying, you said make it taller. So to make this part taller, but I mean technically you could, right? But like what do you want, more facial height? Because there's other ways to get that. You know what I mean? You could get an implant in the bottom of your jaw. I wouldn't do that. I wouldn't get it. I wouldn't do that surgery, but there you go. There's one option. Let's see. 328 said, have you gotten paid yet? I did get paid yet. I've worked like 6-7 weeks now, 6 or 7. Yeah, 6 weeks. This coming week will be the 7th week. So I've worked a month and a half, and this coming week will be my 3rd paycheck. I mean, I just got back from the course in St. Louis because the board's exam is in February. I just got back from that board review prep course and in St. Louis. Fantastic, by the way. Excellent. I know what to study now and how to study it, and I'm ready to go. I'm going to put in 2 hours tonight at some point. Oh, shoot. It's almost 5:30, guys. It's almost 5:30, boys. I'm going to have to get that in right now. Anyway, I did get paid. I got 2 paychecks, and they all went to paying bills because I didn't get a paycheck for 3.5 months, if you think about that. My last day of work, technically work-wise, was May 30th, but I got my last paycheck 2 weeks after that, or 2 or 4 weeks after that. And so June was the last paycheck. So June, July, August, September, and my first paycheck was in September. So it was 3 months. It was 3 months, 3 to 3.5 months that I didn't get paid. So yeah, like guys, I've just been trying to catch up on bills and stuff. I'm just trying to pay off the credit card from the whole summer. You know what I mean? And then at the same time, like I got expenses, the course fees with the hotel and everything. And it wasn't bad. It's just, you look at the paycheck and 5% of my taxes of my paycheck goes to taxes. So I only get to keep a little over like 62% of my paycheck. And it's a good paycheck. Don't get me wrong. But like, and then everything else is so much more expensive in New York than other places, right? So just to keep in mind, you might get a good salary in oral surgery and dentistry, but almost half that's going to taxes. And then there's not that much left. And then everything's so much expensive in certain areas of the country, right? So keep that in mind. It came as a pretty big surprise. All right, let's move on. PZZY fighting for my life, man. GPA currently, well, wait a minute. Let's back up a little bit. I get the analogy, right? You're not literally fighting for your life though, right? If you're talking about GPA, prereqs. So fighting for my life, man. GPA currently before prereqs at 3.6. Cool. Any advice for pre-dents? Just got my first C. Okay, gotcha. And I'm sorry to hear that. You just got it now? It's only October. So how did you mean your first C on an exam, right? You'll be fine. Just put in the work, make up for that C on the next exams, and you'll get it. You'll get an A or a B for the course. You'll be fine, man. Don't get too bogged down. I got C's on exams. I got D's. I got F's on exams, but I never got anything other than an A or B on a course. That's very important, all right? My thing was through undergrad, I don't want anything under an A or B, okay? Only A's and B's. That's what I did. Everything worked out. Got into dental school. In dental school, guess what I did? I only want A's and B's. I don't want anything under an A and a B. And guess what happened? I only got A's and B's. Got into oral surgery. So guys, like you'll be fine. Just stick with that. My thing is, don't get bogged down on a test, one test here and there. Use it as fuel to do better on the next test. Make sure your courses are only A's and B's. If you get a C, I do know people that got into oral surgery and to get a C or more than one C on their pathway. But that was my thing. My thing was just A's and B's. Someone had told me that going into it. That's what I wanted to do. That's what I did. And everything worked out just fine. All right, my friends, let's keep it going. S.S. Best tips for TMJ. So what about the TMJ? A TMJ exam, of course, the TMJ surgery itself, TMJ management, myofascial disorders of TMJ, really related to TMJ, or is it a functional disorder with TMJ? Like you got to define this a little more because the TMJ is a whole nother can of worms. There are textbooks and courses designated for just the TMJ. There are fellowships on just the TMJ. You see what I'm saying? Like that's a big concept within dentistry and oral surgery as well. GMFFL, yes, to decrease the gonal angle. Over here, to decrease this? So you don't want a nice, defined, prominent right angle. All right, there are things you could do. You could do certain things like maybe fillers, perhaps. You could shave down the goni angle if you go to a like, for example, facial feminization. Although I'm seeing facial, feminine people getting a harder right angle of the jaw. But yeah, there's certain surgeons that do that. Yeah, I would shave it down. I wouldn't shorten it. I wouldn't go with that. All right. Khaled0328 67 smiley face. Congrats. Wait, what was the 60? Is that the 67 what? Wait, 67 what? 67? Oh, this isn't it. Can someone describe to me the whole 6-7 thing, that like meme? I don't get it. I don't get it. Please, if someone can let me know. Let's go. Here we go. Where are we? Bieri, how much are you making a year now? How much are you making a year now? I was cool talking about it in residency because, like, yeah, I mean, it's residency. What are you gonna? You're gonna judge someone's house? No, residency is important because you need to tell people how much you actually make in residency, because everyone overestimates how much doctors and dentists and surgeons make. When you're in residency, you're literally making like $7.50 an hour. Yes. And then up to maybe $12.50 an hour. The best ones, maybe they're making $15 an hour. Yeah, that's disgusting for being a surgeon. Outside of residency, now is where we get into a little muddy water. Reason being is a lot of surgeons they earn based on production, okay? And their production dictates it, and then that production differs significantly throughout. There's like, I knew a chief resident who graduated the year before me. He got almost double my base salary, working down in Florida. Almost double. Okay. So I'm at about 55-60% of there. It has nothing to do with me as a surgeon. It has nothing to do with my surgical procedures, my hand skills. So you see how whatever I tell you, and as an answer to that, it's going to come with judgment. You see what I'm saying? And that judgment is based on false pretenses. It's based on a false conceptually. You see what I'm saying? In Florida, Midwest, you're going to be making probably double my salary. But in New York and California, you're looking at maybe between 350 and 450. That's what we're looking at right now. It might be up to 500 in a year or two. Maryland 500, Alabama 650. Some parts of the Midwest, like Wisconsin, maybe like North Dakota, maybe Minnesota. I don't know. I don't know about Minnesota, but I saw as much as 700,000-800,000 starting out. So it's gonna vary significantly. And so another thing is, I don't really like to talk about salaries after residency. Is that there's such it's like a movement in the United States these days to attack people that make a lot of money. And no matter what I say, some people are going to say, in residency, some people are saying like that's a lot of money for a doctor. And no. $69,000 as an intern resident working over 100 hours a week. No, that is not a lot of money. That is literally $7.50 an hour, about $7.50 an hour. It might be even less because remember, I only received about 45,000 of that, 45 to 50,000 of that, because the other 69,000 only comes down to 45.50 after taxes. And in Manhattan too, there's another 10%. So you got to understand like where these things come from. And it's like everyone wants to attack people that make money in the United States. It's I think we need to incentivize hard work. We need to incentivize good grades. We need to, just because you get good grade, like we need to incentivize hard work. We need to incentivize innovation, creativity. So, there's a lot of things going on. Goober, do you still have metabolic pathways burned into your eyes? No. What? Pathways burned into your eyes? What do you mean? What? Maxie said, how often do veneers need to be redone? Great question, Maxie. I'm sorry. I don't have the answer for that, unfortunately. Goober said, I've just been staring at these things for days, losing my mind. I know, Goober, dude, those metabolic pathways. I mean, some of them, it's good to know, right? I wouldn't get bogged down with literal diagrams and pathways unless you need to for exams like in organic chemistry, for example. Hamza said, it's the same in the UK. Tax eats our living whilst also having a lower salary. Yeah, but you guys get out into working in the UK faster than the United States, and our tuition statements in the United States before working are significantly higher than yours in the UK. And you guys got to consider that. If you want to make, I don't know what you call US money, but in New York, like the amount of taxes we have is comparable to the UK at this point in time. Look, I know it's bad over there. I'm telling you right now, it's bad over here too. I live here, and I was just in the UK. It's pretty bad, okay? California as well, among other places. But listen, what I'm trying to get to is that, remember, your undergraduate dental school, undergrad, $50,000 a year. My undergrad, some of them were $55,000 a year. Dental school, $60,000 to $80,000 a year, and that's a cheap state school. So you have NYU Dental School, NYU College of Dentistry. That's over $125,000 a year, and that's not even including your rent. So Hamza, you want to make that money? It's going to take you at least 10, 15 years to pay that kind of debt off. You see what I'm saying? Shining Light 2025, 50% in UK as a dentist and only 120K salary. So here's the problem. This is what I'm talking about. Why do it? At that point, you're dealing with patients every day, and not every patient is a walk in the park. Not every case is easy. And then dealing with that patient on top of the case, not everyone is, especially in the United States, I'm noticing not every patient understands what's going on. Not every patient understands how like unique and complicated and how much years of education and training and how delicate you need to be with your hand skills to prevent complications from happening. Like, I don't know. There's just people don't understand kind of like what's going into it these days. And so I think dentists, doctors, lawyers do pretty well, but then, physicians, dentists, and surgeons, I think they should be all making more money. This is contrary to what a lot of people think, but the amount of money that dentists and surgeons and physicians are making these days is comparable to like the 90s. It's very comparable to the 90s and 2000s. But if you trace the line of inflation, like the ROI and the cost of living is going up a lot faster than the reimbursement is going up for dentists and physicians. And that's a big problem because that affects, as cost of living and everything goes up and tuition, everything goes up. But the amount of profit margins that physicians and dentists make, it's less incentive to go into it these days. This is a big problem. Don't you want, God forbid, you get like brain cancer or something, don't you want to have the best, most talented, most intelligent, brilliant, hand skills, perfect surgeon in the world? Well, that surgeon also needs to have a life on their own, right? And in order to have a life on your own, you need to be able to, that one day you get off a week, you need to be able to go and spend time with your family, your kids, do the thing that you want. And the less profit margins we have for that, it just doesn't incentivize going into these professions. So something needs to be redone because we need to give providers the utmost autonomy, freedom, ability to make decisions on their own, focus on just patient care. And man, this is such a big can of worms to open and talk about. So I'm going to move on. But yeah, it's really bad in the UK. It is. And it's declining in the United States as well. I want to see it get better. But the reimbursement for very important procedures and skills and education and training that throughout the world that dentists, physicians, surgeons are making continue to diminish. And that's a big problem because we need to incentivize the most talented, intelligent people to go into these pathways. So that's my little spiel there. Exclamation point said Owen Hunt. Yeah, I get that a lot. PZZY said midterms. Gotcha. The midterms. Okay. That's not going to be how you finish the course. You still have finals in the second half of the course coming up, though. You got to crush that second half. That's the only thing you could do. That's the only way you're going to get out of this hole. Jay said, would you still go dental if your loan is $600,000? You got a 24 DAT, but low undergrad GPA, doing masters right now. You got a 24 in the DAT, man. Jay, that's an excellent score. Did you at least try to apply to dental school? Because you're doing a master's now, but you just asked if $600K loan would be too much to go to dental school. Forget about what I want. I hope you just got a 24 in the DAT. You said low undergrad GPA, but you didn't tell me what it is. So I'm assuming that might be subjective. Now you're doing a master's, which you're paying for, right? So you're paying for a master's and you're worried about what it might be when you start dental school. But in a year or two, it might be even more. It might be even more money, you see? So I hope you did apply with that 24 and your initial GPA and you're not just continuing to go to school and pay for that school when you could have got in. Bieri said, currently a D2 at NYU and stuck between perio and OS. Any advice? I shadowed both, still can't make up my mind. You got to shadow more, got to observe more, do those procedures, go in both clinics, work with their residents, see what you want to go into. They're very different. They're very different. Maybe you get over to Bellevue and see what they're doing on a weekend. I would have dental school students shadow me all the time when I was at Bellevue. And, over there at NYU, you could come in, go in on rounds, go say hello, I think it's Sanjay who's the chief on service at Bellevue right now. Sanjay's great. Sanjay will have you in. And Joey Zoida. Joey Zoida is one of the senior residents on Bellevue right now. Yeah, go say hello. S.S. management and candidacy for surgery. What for management and candidacy for surgery of the TMJ? So you'd have to go into a consult and we'd have to determine, is it a myofascial pain or function, whatever disorder, myofascial, or is it a functional deformity of the TMJ? Okay. Pathology of the TMJ. Those are surgical routes. If it's myofascial, that's a good thing. Do you really want to just hop, skip, and jump into surgery? Most management of the TMJ, at least in the beginning, most of it's conservative management until it gets to a point where it needs to be you need surgical intervention on that TMJ. But just keep in mind, the more you open up that TMJ, the more you open up that joint to the environment, to surgery, to different things, the more likely you're going to need further surgery in the future. So look, the one thing I recommend to patients, this is not medical advice, this is just personal recommendation that I make, is go through all those conservative measures first. If you're having a significant amount of pain and it's limiting your opening, you keep continuing to have open lock or closed lock, yeah, then you might be going towards the direction of surgery. But it's very important to make sure that you can't get away with conservative therapy, because once you open up that joint, it's very likely that you're going to have to continue to need surgery in the future. Does that make sense? Think about that, right? Ioannis said, what's the process to work in the US with a European diploma? Well, it depends, because in dentistry, it's a bit different, right? In dentistry, you still usually need to go to dental school before you can work in the United States. On the medical side of healthcare, it's different. On the medical side, you can, wow, it's so windy out. Oh my God, I'm looking at trees go like this. Full trees go like this. There's a nor'easter in the United States right now. I'm on Long Island. I'm in Smithtown, and I'm looking at, oh my God, it's pouring out right now. And yeah, the trees are just, they look like blades of grass. Wow. Anyway, I had to bump up my flight. Earlier to yesterday rather than today, this morning. Anyway, so process to, yeah, on the medical side of healthcare, there's a chance you probably could come over to the United States and work. But yeah, so loading ... said, why OMFS? Just curious. I thought general dentists can do the things at your practice. Some of them can at my practice, but can they do them well? Did they specialize in that area? No, it's added training, it's added supervision, it's added learning. It's because what happens when general dentists do things that go wrong? Where do they go? They come to the oral surgeon. Okay. All the other specialties go to the oral surgeon generally when things go wrong, unfortunately. And there's a lot of scope creep. There's a lot of general dentistry and other specialties creeping into higher level procedures, more invasive level procedures. And is that safer for the patient? Is that really safer for the patient if you're not someone who trained and specialized in very invasive surgery to be doing very invasive surgeries? What do you think? And you don't know how to handle the complications that happen with those very invasive surgeries? Is that appropriate? I don't know. Might be a lawsuit coming down the road someday. Who knows? Meow said, hi, handsome. Hey, Meow. Stas K said, I had a root canal last month, and I just did a check with the dentist. I have a gum infection. Okay, we'll get that gum infection taken care of, right? Antibiotics. Maybe you need incision and drainage. Not medical advice. One more time. Maybe you need to redo the root canal. There's a lot of things that you need to be done. Miranda Purple Panda, follow the live creator. Thanks, Amanda. Follow the live creator. Thanks, Miranda. Ben Stone said, how do you keep yourself sane during residency? How did you find time for family, friends, your health, budgeting, prioritizing what you need to get done, get those things done, and then immediately get out? Like, for example, for me, Friday nights, I need to see my friends. I need to see my family. I need to see my fiance. Well, in residency, she was my fiance, right? But I would need to get out. I need to get away from my apartment that's right across the street from the hospital. I got to get away from the workplace. I'll go to the Upper West Side of Manhattan where she is. I would spend time with my friends. I would spend time with her sister and brother-in-law. I love them. They're like my brother and sister, and got to get away. Get away. Separate yourself from that workplace, mind and body, physically and mentally. You got to get out. You got to get away. So I would try and get a workout if I had time, but many times I wouldn't. So Friday, finish the day, get out, go. Saturday, do the things you got to do, right? If I was working again Sunday, Saturday night, I would get back to my apartment and wind down. I would try and wind down with an appropriate amount of time. Maybe I would watch a show with them, have dinner with them, head back to the apartment, get ready for the next day. Okay. But that whole Saturday, mind out. Like if you needed to do a presentation for, I don't know, but many times I was on call on Sundays and then the full day, Monday through Friday of work. But you need to know those things. So during the week, when it was day to day, exercise. I would have like certain days I would try to hit these exercise. I wouldn't exercise after 8 p.m. though. I wouldn't start a workout after 8 p.m. If it was late, I would just start preparing for the next day. Don't get yourself bogged down behind. Make sure you can keep that wind down hour. Eliminate the distractions and go right into a wind down hour. Brush your teeth, shower, maybe you shave, maybe you fix your hair. I would make my lunch the night before. I still do. I make my lunch the night before. I put everything together and I get ready for the next day. In my wind down routine, put on some music, like relaxing time. Having that little hour to an hour and a half every single night is so crucial because that's your time. That's your moment. That's your time to just kind of decompress and unwind. Think about whatever you want to do. Sometimes I would listen to jazz in the evening. Most times of the years when I'm winding down, I listen to Adam, Attom. You would find him on Spotify and stuff. So exercising every day of the week is big. If you miss it, don't get bogged down with that. Hit it the next day because sometimes you get out of work late during residency, right? DDK said we should all leave WHO. Who's? What? We should all leave PPOs. Oh, yeah, the PPOs. The PPO. Maybe. Dude, I'm taking Medicaid and PPO. Some of these PPOs are outstanding compared to Medicaid. I mean, how long can I possibly, for my career, be taking out full bony impacted teeth? That's a very delicate procedure, but for $62.50 for $75 a tooth. Look, guys, like I know you think, oh my God, there are periodontists in our area that are taking out full bony impacted teeth for $1,000 each, and they didn't train specifically to take out full impacted wisdom teeth. Oral surgeons do. Why am I getting paid like some of them $220? It's better, but who didn't train it's getting $1,000 tooth in our area, and we're getting $220. So yeah, Medicaid is tough. Medicaid is really tough, and I'm all for doing surgery for the patients, right? And not worrying about the fees and everything, but you need to be aware of those fees because you need to keep your boat or your practice, like your business, afloat, right? If there's so much more money and at those Medicaid fees, there's a lot more money going out of the practice than coming in at times. Okay. So yeah, that's serious. DDK said politicians are allowing insurance companies to control MDs and DDSs. Correct. That is 100% correct. DDK knows what he's talking about. And DDK, let's keep going on this. I'm sorry it took so long to get your things. Tim Hanna said, what do you think? DDK, let's keep this going though. Tim Hanna said, what do you think about endo as a specialty when compared to GP? Is it worth it to specialize in it? If you like endo, if you find yourself really good at root canals, you like to do it, apicoectomies, do it. Do it. Like, you got to understand, like, you got to do that specialty a little bit, get exposure to it, like shadow, observe, assist those residents in the endo clinic as much as you can and figure out, is this something you want? Can you picture yourself in that resident seat? Can you picture yourself in the endodontist in private practice's seat? That's what you need to find out right now. I got a buddy who's Yeet Goal. He's out here on Long Island. He's an endodontist and he's doing really well. And I think he is with a DSO and he says he loves it. That's all that matters. Guys, we got to get back to the basics. Do you like your career? Are you excited to get up every morning and go into work? That's what it's all about. You understand? Sam_Miller.3. What is a bariatric surgeon? They do like gastric sleeves. They do a lot of work around the stomach, the GI tract, gastric sleeves, gastric bypasses, stuff like that. Okay. Hiatal hernia, stuff like that. A Patel 7702. How on earth did you study for the CBSE during dental school? What was your GPA while studying? So we didn't have like a GPA or a ranking during dental school. Thank God. That does not help mental health at all. And the fact of the matter is that you just need to study hard. So we were graded, but we didn't have a GPA. We weren't ranked. And you could judge yourself based on your GPA, based on those grades and not your GPA. I think that's much better for mental health in these very stressful professional career environments. And how understood I study for the CBSE? You can just make time. It's just making time for it. There's no better answer. And unfortunately, that's a pretty poor answer. I know. I'm not happy about it. It's not great. Oh, I got to change my laundry too. It's not great. I know. But you just have to push. You got to work for it and you got to make time for it. Okay. You got to adjust your schedule. DDK said OS residency is Butler. So many are 6 years now. Do perio. I don't know if I agree with that. There are a lot of 6 years. That's why I did 4. But you said OS residency is Butler. What does that mean? I wouldn't do perio, DDK. I don't know if I'd agree with that. It really depends on what you want to do. And yeah, I got a lot of things about that. I disagree on that one, DDK. Erwin DDS said, dentistry has been exceptional for me. I bought my practice when rates were 3.7%. Things are different now. Yes, they are, Erwin, Dr. Erwin. But thanks for including that, Dr. Erwin. If I was to open up my own practice in New York, Long Island, or buy into another one in the area, or buy into my current existing one, which is huge now. Say here, Dr. Irwin, talk to me. I'm at a practice. He's got 8 or 9 practices, 9 surgeons working for him. It's owned by one guy. Didn't sell out to a DSO. It's still its own private practice. I'm working in one office. I really like working at that one office, and it's doing well. I'd like to work my way off Medicaid fees over the year. I'm sure you know what I mean. But to go about like contributing enough to be like partner worthy, and then how would I go about that? It wouldn't be buying into the whole thing, would it? Probably not. If that's huge, that's not my practice. Or maybe I would start with the one. If I can get an offer of that, what would you recommend me do this first year or so, Dr. Irwin? I'm curious for your advice if you have a second. Jay said my undergrad GPA is, where'd it go? Jay said my undergrad GPA is 3.0. I applied this cycle with no interviews yet. I'm doing my master classes for a GPA boost. Gotcha. Okay, that does make sense. That does make sense for now. I think you should keep at that and get that GPA up. But hopefully that master's is in 2 years. You know what I mean? DDK said TMJ surgery is rare and should stay rare. It's rare. Some people do a lot of it. Some people don't do much of it. DDK said at J ace your DAT. He did ace his DAT. I was on admissions for UW Seattle. High DATs can help a lower GPA. Exactly. That's what I would recommend do. He did get a 24 on the DAT though. So that's exactly it. Yeah. Great advice there though, DDK. DDK said that's the key. You want to avoid the complications. I do agree. Stas Sheshnev, follow the live creator. Thanks, Stas. Glenn Roy said, oh, I lost it. Where did Glenn Roy? Glenn Roy said, I have double jaw surgery in 3 weeks. Super nervous, but also excited. Oh, gotcha. Good luck. Yeah, I can understand how nervous you're going to be. And you probably get more nervous as you get closer to that date. But just stick with it, all right? Do all the things that they recommend to prepare. Make sure you have your hooks on your braces with your orthodontist. Jay said, at DDK, I got a 24. Yep, there you go. Ali said, any Any tips for dental school interviews? Yeah. What do you want to know about dental school interviews? It's a conversation. It's not a multiple choice exam. So make sure you don't walk in thinking like you're just answering multiple choice exam in that regard. Okay. Said, do you feel that there is a complex among dentists that they didn't become doctors? Some of them, they do have it. Some of them don't. It's really a person to person thing. And it's unfortunate because you shouldn't be going into a career pathway just to become one thing or the other, just because you didn't get into medical school to go into dental school. That seems to be pretty flawed. Preston said, can you explain how I got an infection in my wisdom teeth extraction 2 months later? 2 months later, huh? That is a long time. 2 months later is a while. It can happen, but I don't know your specific situation, Preston. So that would be hard to tell you. If it was 2 to 4 weeks, that would make sense. But 2 months, so 8 weeks later, was it a full 8 weeks? That's interesting. I'm not sure. User 817545, only 20 when graduating. Should I take a gap year? Don't take a gap year based on your age. You want to take a gap year based on, did you hit all your prerequisites? Did you apply? Did you get in? Do you still need to take the DAT? Don't take a gap year just because you're graduating young. Figure out if you need to take a gap year. You know what I mean? Randall Gezzi said, hi, doctor. Hey, Randall. User 442489. What extracurriculars did you do for OMFS? Well, I was on ASDA. I was treasurer of our class. I was treasurer of ASDA. I did a little bit of research, but biggest things I think were like biggest things I would say were externships. CBSE, that's number 1. 2 is externships. 3 is letters of recommendation, doing your programs, your dental school's journal club, spending time with the residents, going to the OR with your program, things like that. Randall Gezzi, I'm a maxillofacial resident in Arab country. Do you know how to start maxillofacial board in Canada? I'm sorry, Randall. I don't know. I'm unfamiliar with that. Ralph P.15. Hi, do you think starting dental school at 27 years old is too late? Nope. I know people who were in dental school, starting dental school at 27 years old. I did. Yeah, I know people that started dental school after that and finished residency at 48 years old. So yeah. HUD said, which do you think is more competitive, OMFS or Endo? They're both competitive. They are. They're both very competitive. I would go with OMFS. I think OMFS is more competitive than Endo. There's going to be a lot more prerequisites and things that you have to do to get into oral surgery too than you would need to in Endo. Goober said, if you were given the opportunity to redesign how residency programs work, would you? Yes, I absolutely would. I would change a lot. What would you want to change? I would want to advocate to get into dental school more. I know a lot of pushes over the years for oral surgery, residencies, programs, faculty, everything, were to push to get away from the dental school and more into the hospital. And that's like pushing to go more and more the medical route. I think we need to make sure we keep our feet on the ground in the dental school to make sure that we take ownership over our space in oral surgery, because you see this creeping of other specialties into oral surgery procedures. You got perio doing exposed implants now. Perio is getting fed all the implants at some dental schools, many dental schools in the United States, and then oral surgery misses out on that. But oral surgeons still do 50% or more of the implants in the United States. So it's a big part of it needs to be a big part of our training. There's a lot that goes in. That's just part of it. We would need to we need more residents in the dental schools too. A lot of these dental schools, they're sending everything to perio. And like at NYU dental school, when we would rotate there from the hospitals, it would just be 1 to 2 residents in there, and that's it. We would have 2 running rooms, and that's it. There's like the international oral surgery 1-year training. They would have 4 or 5 rooms, and we would only have 2. So that's a little weird, wouldn't it be? There's a lot of things. I would need to get back into the politics of the dental school to make sure that oral surgery gets the respect that it deserves, because I also don't think that dental schools are given any respect to some of these oral surgery programs and the attendings and the residents. There's a lot that needs to be done. There's a lot. Jay said, I'm curious if you thought that the anesthesiologist you worked with had a good lifestyle. A lot of them did. Yeah, I think anesthesia was fantastic. I really do. Preston said, sorry, it was more like 6 weeks. Socket was stitched. My doc said I can smoke again after a week. Probably, I noticed infections that happen. I noticed them in sockets that were stitched. If they are left open, they might not look good, right? And they might not heal great, but they're less likely to get infection. In some cases, this is just some cases I've noticed, right? So that's something to consider. And yet, smoking, I don't think had to do with it. I don't think it, but 6 weeks does make more sense. Yeah. For anywhere between like 2 to 6 weeks, that can happen. I think that's what happened there, Preston. Yeah, that does make sense. But stitching helps with healing, So There's so many variables that goes into the situation of an infection after wisdom tooth is removed. Okay. T-Bone Blue Sky share the live. Thanks Blue Sky. Preston said the doc didn't numb me when he cleaned the infection. It was so painful. What? Did he give you local? Did he give you lidocaine? Any Novocaine? What? The kitty in black preparing for my OCE. It's so expensive. Oral certifying exam. You're preparing for it? Where were you at the course? The kitty in black. What's your name? Did I see you there this weekend? Let me know. Let me know what. Make sure that should be fine, right? That should be fine. Wait, how long should I wait before smoking after a wisdom tooth removal? Well, I can't recommend smoking at all. You know that I can't advise that that's good at all because it's not, and it's related to other complications and comorbidities. However, if in the event, I would wait at least a week. I would really try and wait at least a week. Okay. Goober said, "Have you heard of the term country club in reference to some programs?" Yes, I have. Yes, I have. Ibrahim filed the live creator. Thanks, Ibrahim. Thanks, man. Let's see. Preston said, gave me nothing, just started to dig in the socket and clean it. I was nearly crying and went, oh my God, I'm sorry that you had to go through that, man. That is horrible. That's really bad. Michael Sharobim, downsides of a 4-year OMFS residency over a 6-year. Downsides, I mean, you don't get your MD. You don't spend 2 years in medical school doing all medical school classes. There was someone that made the analogy for me. It was like, if you're a car mechanic, but then you go and work on boats for 2 years and then come back to cars like a year or two before you graduate. I don't know. Does that seem, I don't know. That's what they do. What's the downside? I mean, you don't get your MD, but like you don't need it. What's another downside? Just the knowledge you learn in the med school courses and stuff, you know? I guess that could be it. Where are we? Preston, follow the live creator. Thanks, Preston. Thanks, man. Do you think Goober said, do you think they are just as valuable in training competent surgeons? If who's Goober, you're saying, do I think if country club programs are just as valuable in training competent surgeons? Yeah. You're still going to graduate an oral surgeon, right? To be a competent surgeon, I mean, that's where the board certification comes in. I think that they really kind of filter out people that fail that are still competent surgeons. That's not what I'm saying. I think they really try and standardize and make sure that oral surgeons that are board certified know what you need to know to be a safe doctor, a very effective surgeon, and a safe surgeon as well. That's probably the number one thing is safety that they do with that. He said, Dr. G, please respond to my DM on Instagram. Yeah, I will. Dude, I'm like, because I just got back from the course. I'm like a week or two behind Instagram DMs. I'm sorry about that. And on TikTok, I don't even know if I'm ever going to get to some of the comments and stuff. TikTok, I'm so overloaded with that. But on Instagram, I do end up getting to everything at some point. I do. COFT 170K net worth at 27, good or bad? I think that's excellent. I mean, it depends on do you have a good quality of life with that, right? Joe Rogans said, which residency do you recommend for someone who wants to do lots of implants and all NX? There are a lot that do all that. I mean, you got to find the residency program. I got very lucky. By the way, VCU is excellent for that. I got very lucky with Dr. Orentlicker. Dr. Gary Orentlicker came to our program at the VA my second year, and I got to work with him for several months planning all NX cases all the time, and that was a big part of that. Ended up being a big part of my training. I got around 20 arches or so. It was excellent, and it's one of my favorite things to do in dentistry. I would love to do them in private practice, but I guess I need to meet dentists in the area that have patients that need this procedure and can afford it. It's a very expensive procedure. It requires a lot of training and skill and work collaboration between the dentist and the surgeon. Georgie said, is prosthodontics or periodontics a better direction to specialize in dentistry? I mean, it's going to be different for you. Do you want to do more prosthodontic restorative work or periodontics, which is more like maybe surgery around the areas of teeth and stuff like that, you know, more invasive surgeries? Minimally invasive, yes. Perio is minimally, I would compare it to oral surgery, but prosthodontics is not much surgery, right? So you need to determine, do you want to do more of a surgery thing or do you want to do more restorative tooth conceptually, you know? Yaskin said, can you please interview one of the dudes on the DMD/certificate route at UAB, OMFS route for MDs? Yeah, I mean, sure. Can you get them in touch? Can you get them in touch with me? Send me one and I'll ask them to come on. Yeah. Tori said, please, doctor, do you know if there are any periodontology fellowships or is it just periodontics? Just periodontics. Preston said, I wish you were my surgeon. You were very nice and explained very well. Well, I don't want to keep you in the dark. You know what I mean? It's very kind of you to say that, but there's so many great surgeons out there and I'm sorry that happened to you. But yeah, I try and I mean, I've been told I explain too much, but the fact of the matter is I don't want to keep patients in the dark. I want to make sure that you know everything and more going into that procedure of what we're going to go through, what's going to happen, and what to expect after the surgery, right? I think that's the key. That's the key. And some patients don't want to know it, which I'm like, look, then that's going to be someone else. I'm going to give you everything you need to know. I'm going to answer every question you have in depth, and I want to know that you're going to be okay. Val said, what's up, Val? Val said, do you know Dr. Vishy Bromand? Yeah, that does sound familiar. I think I do know Vishy. Yeah. Yeah. S said, for third molars, Georgie, do you work closely with pathologists? More or less, yeah. I mean, we send them our pathology, right? We do a biopsy, send it out to the pathologist. All right, friends, that's it for TikTok Live number 80. I got to go get some studying in now. And Val liked the live. Thanks, Val. You're awesome, Val. Thank you. Val, let me get you back on Instagram. You're in where are you right now? You're working in dentistry, right? Send me an ad on Instagram. I'll get you back. All right, guys, signing off now. TikTok Live number 80. The top 5 listeners. Oh, you're in Arizona. Nice. You're in Arizona where? In dental school or you're practicing? You're practicing in Arizona, right? Top 5 listeners. You have their emails. I'm not going to email them. Yes, I'm not going to. Can you DM me their handles on Instagram? I'll reach out to them there because I don't know. I don't know if UAB is gonna want to come on the podcast and chat, but I will try. I would love to ask them some questions. Val, where are you practicing in Arizona? And yeah, so TikTok Live number 80, top 5 listeners. I give you guys a shout out in the caption of the podcast and when I post it. And Joe Rogan said, how often do you do the lives? I try and get every Sunday night. If I don't hit Sunday afternoon, evening like this, then it's like Monday or Tuesday. Okay, but I try and get one day a week for you guys, and I'll be posting this maybe during the day, probably during the day tomorrow. During the day once I get to work, okay? Because right now I got to go study. So I hop on for a quick 30, 40 minutes, maybe 20 minutes sometimes, and then I'll be posting it tomorrow, the full version on YouTube, podcast, X. I post it there, and then put up a post on LinkedIn about it too. All right, my friends, have a good night. Let's make it a great week, okay? We're in the nor'easter right now, so let's make the most of these little more downtimes. All right, friends, thanks for coming on.